Hello, my name is Justin Burton, Director of Safer Care Texas. Safer Care Texas is a department within the University of North Texas Health Science Center. It was founded as a response to the national challenge to improve patient safety. We work to eliminate preventable harm through advocacy, education, innovation, and service in Texas and throughout the nation. You may be asking yourself, what is patient safety? Patient safety means making sure that when you go to the doctor or the hospital, you are kept safe and don't get hurt. It's like when you wear a helmet when riding a bike to protect your head. In healthcare, it's about doctors and nurses doing things carefully and checking everything to keep you safe and healthy. The World Health Organization reports that around 1 in every 10 patients is harmed in healthcare, and more than 3 million deaths occur annually due to unsafe care. Additionally, they report that over 50% of harm is preventable, and that half of this preventable harm is attributed to medications. Today, we will be discussing one of the common causes of patient harm, medication errors.
Hi, I'm Jennifer Barrow, Clinical Executive at Safer Care Texas. Let's start with some medication statistics. According to the World Health Organization, medication-related harm affects 1 out of every 30 patients in healthcare. The Agency for Healthcare Research and Quality states that 160 million medication errors occur in primary care each year. According to the National Institute of Health, the total cost of looking after patients with medication-associated errors exceeds $40 billion each year. In the United States, 7,000 to 9,000 people die as a result of a medication error every year. Medications are generally safe when taken as prescribed or as directed by the label, but there are risks in taking any medication. An adverse drug event is when someone is harmed by medication. The Office of Disease Prevention and Health Promotion states that 1.3 million emergency department visits are caused by adverse drug effects, totaling about 350,000 hospitalizations each year. Patients do experience, but often do not report adverse reactions or other medication complications. Medication errors can occur when prescribing medication, when entering information into a computer system, when the medication is being prepared or dispensed, and when the medication is given to or taken by a patient. These errors can happen in clinics, hospitals, pharmacies, and at home.
Hello, my name is Leslie Reyna, and I am the Assistant Director of Strategy and Outreach for Safer Care Texas. One way that people can help reduce these errors is by carefully reading their medication labels. The label on your bottle contains important information to help you take the medication as intended. Labels include medication name, dose, which is the amount of medication taken at one time, directions on how and when to take the medication, and warnings of things you may experience and should report to your healthcare provider. Show that you understand how to take your medication. Repeat information about your prescription back to your healthcare provider or pharmacist. Storing your medication correctly can not only help reduce medication errors, but can impact the medication's ability to work. Follow these 3 tips for medication storage. 1. Heat, light, and moisture can damage your medication. Always store medication away from potentially humid areas including bathroom cabinets, stoves, sinks, showers, baths, and any hot appliances. Always take the con out of medication bottles as they pull moisture into the bottle. 2. Be cautious when using pill organizers as they remove medications from their original prescription bottles. Always make sure to keep the instructions and label information. 3. Throw out all medication that are out of date and make sure you removed any identifying information. Make sure you mix the medication you are throwing away with dirt, old coffee grounds, or cat litter so that children, pets, or anyone else who might accidentally take them are less interested in swallowing them.
Hello, my name is Juana Escobedo Bermudez and I am a community health worker. One of the questions people have regarding medication is the difference between generic and brand names. According to the United States Food and Drug Administration, generic medication must have about the same active ingredient, strength, dose, and route administration as a brand name medication. Most generic medications are produced in the same facilities as brand name medications. The key difference between generic and brand name comes down to the price. Generic medications generally cost between 80 to 85% less than their brand name counterpart. Generic manufacturers can provide more affordable products because they are not required to conduct costly clinical trials for new medications and do not have expenses for advertising, marketing, and promotion. Now that we have learned about medication labels, storing your medications, and generic versus brand name medication, let's talk about the dangers of ordering your medication online. Buying prescription medication online or through social media may seem to cost less, but it can put you or your loved ones in danger. Counterfeit medication is fake medication designed to look like FDA-approved medication. These fake medications are not inspected, nor are they regulated by the FDA. Ordering medications over the internet increases your chances of receiving fake medications. Avoid online pharmacies that do not require prescriptions. Check your online pharmacy through the National Association of Boards of Pharmacies Safe Site Search tool. Contact your pharmacist or healthcare provider if you have questions about your medication.
We have given you some valuable information about medication safety. Now it's time to put what you have learned into practice. A key tool in preventing medication errors is medication reconciliation. Medication reconciliation is the formal process of creating the most complete and accurate list of a person's current medications and comparing the list to those in the person's medical record or medication orders. Reconciliation should be completed at every healthcare visit to prevent medication errors. One way people can reconcile their medications is by making a medication list.
Follow these tips to create your medication list. Update the list when your medications change so you are prepared to share it with all members of your healthcare team. Tip number 1, use a blank sheet of paper and/or create a digital Word document. Tip number 2, list all of your medications, how you take them, why you take them, and how often. Tip 3, write the name and phone number of the person who prescribed you the medication. Tip number 4, write the name and the phone number of the pharmacy where you are obtaining your medication. Tip number 5, list all non-prescription medications, vitamins, herbal products, or supplements you use. Lastly, tip number 6, write down any allergies or sensitivities to medication.
Congratulations! You now have the tools and knowledge to keep yourself and others safe from medication errors. Remember these 3 tips as you share what you learned today. Always tell your healthcare team about all the medications you're taking, including vitamins, herbals, dietary supplements. Number 2, stay with your treatment plan. Ensure to complete the full course of antibiotics as ordered. Do not stop taking the medication because you start to feel better. Ask your healthcare provider about the possibility of getting a refill for your prescription or if you want to stop taking your medication. Number 3, keep a list of all your medications. Write all of your prescribed medications, over-the-counter medications, vitamins, and dietary supplements. Always remember, safer care starts with you.